What other things can people do, I guess, other than diet and exercise to really reduce the risk of having cardiovascular disease?
All right. Well, thank you. And I think that would be the big finish here. So nobody turn this off yet. I do combine in my medical practice and in my writings, kind of this lifestyle intensive approach, but very high tech, the test, not guess approach. So I would urge, if I can probably come up with three, and one of them is going to be very self-promotional, I apologize. Get better than average lab tests. Ask your primary care doc. Maybe challenging in the UK, maybe challenging in the States and around the world and Australia. Ask for at least a cholesterol panel, of course, but maybe something called an advanced cholesterol panel. I just published a book last month about an unusual cholesterol called lipoprotein little a. Lipoprotein little a. It's a very inexpensive blood test. Very few primary care docs order it. It's the most common genetic cholesterol. 25 to 30% of the world is born with a cholesterol that doesn't show up on the routine panel, and it can cause you to have an early stroke, heart attack, or even a heart valve operation. Get it checked once in your life. Lipoprotein, we call it little a because it's lowercase a. It's very awkward, but it's something scientifically that's strongly researched. And the European Society of Cardiology, getting closer to your location, recommended in 2019 everybody should have it checked once as a consideration. Find out what your inflammation is, high sensitivity C-reactive protein, and get these vitamin levels done. So ask your doctor, can we do a few more blood tests than average? I'll tell you where you can find more information. Number two, there is a CT scan. There's a CAT scan. You're talking to a large, an executive crowd. At least in the States, for $75 to $100 American, you can take 10 seconds, lie down, get a CAT scan of your heart, and find out the truth. At age 40, 45, 50, is this working well for me? Are my arteries clean, free of disease? Or am I on a path for potentially some tragic event in 10 years that I need to really change my lifestyle? It's called a coronary artery calcium scan. And at least in the States, it's still rarely ordered. It's been around for a couple decades, and it's very inexpensive. But it is critical to predict the next 10 years and intensify your lifestyle and your treatment if you're abnormal. And if you're normal, it relieves anxiety, but don't start eating ice cream and smoke cigars. That's not the idea. And this is where I mean promotional. I wrote a book about 4 years ago called Dead Execs Don't Get Bonuses. Provocative title, Execs, but it's on Amazon. It's been a good seller. It's a small book. It tells you step by step. It's really not a diet book. I've written diet books, but it's the technology as a cardiologist. How do you detect atherosclerosis early or detect that you don't have it? And if you have it early, what steps can you do in terms of lab work to go a little deeper? And then, of course, what can we do to really start to reverse it? Heart disease reversal, type 2 diabetes reversal, autoimmune disease reversal should be the language that medicine incorporates. We manage it. It's very lucrative for pharmaceutical companies to manage disease for the rest of your life. Write a script, write a script. But, radical change in your lifestyle can make many of these diseases disappear, which is the most exciting thing that I do.
And Dr. Kahn, how can people get in touch with you?
Sure. I have a central website. I'll just spell it out for simplicity, drjoelkahn.com, but that's drjoelkahn.com. I'm sure it'll show up in your show notes, drjoelkahn.com. And I see people from all over the world by technology and have been able to order some of these studies on people all over the world. And it's very enjoyable. I mean, I'm 61. I've got a lot of years left to practice medicine because I enjoy it so much, and making an impact and either reassuring or identifying disease that we really need to work on. So it's the good stuff.
Awesome. Dr. Joel Kahn, thank you very much for your time. Brilliant interview. Thank you.
Thank you so much. And your audience, I'm sure, will benefit from all the good work. Keep it up, you guys.
Well, thank you. Appreciate it.